So we are here with another video of medical education series. Now we are asked in the medical education exam that how will you break the bad news to a class of 250, or how will you teach breaking bad news to a class of 250. So teaching to such a large group is not possible. So what we should do, we should divide the class into small groups, batches, and then first we will demonstrate how to break the bad news via spikes model, and then we will ask them to perform. We will give the role plays. One student should become a patient, one should be the doctor, and other should be the attendants. So we will perform a role play, and we will assess that whether students follow the spikes protocol or not. So in general, the doctor should be able to deliver the bad news clearly, honestly, sensitively, in such order that patient can both understand and feel supported. So what is the spikes protocol for delivering bad news? Well, it has got 6 steps: SPIKES. S, the setting of the interview; P, the perception of the patient; I, the invitation to the patient; K is the knowledge giving to the patient; E is the emotion or empathy with the patient; and S is the summary or strategy. So now we will discuss each step in detail. Setting up means that you should take the patient or the attendants to a comfortable environment, comfortable room with full privacy. There should be no interruption. You should respect the confidentiality of the patient. Make sure you have thoroughly studied the case and you know every detail of the case. Also consider other senior member to be with you, but it will depend from case to case. Now the next step is find out how much the patient knows. Particularly, is he aware of the seriousness of the situation or not? Ask, what did the referring doctor told you about the illness, that how is the condition? Patient words, patient or attendant words or body language will also tell you about his perception of the disease. Now the third step is find out how much the patient wants to know. You can ask him like that, you don't want to be bothered with the details, do you? But doctor must commit to honesty and full informing the patient if the patient wants to know each and everything. Now step 4 is giving knowledge to the patient about the disease, about the situation. So there is an order, a sequence, like you can tell him the diagnosis, then the treatment plan, then how is the prognosis, and what support you can offer. Then the step 5 is responding to the patient feelings. Show empathy because it allows the patient to express their feelings and worries and provide support. Don't argue. Allow expressions of emotions without criticizing. Now step 6 is strategy and summary. Plan and follow through. Make a plan and tell him all the possible scenarios. Prepare him for the worst and hope for the best. So that's how you break the bad news. So I hope after watching this video you will be able to answer it in exams. Thank you very much.